My name is Feroze Sidhwa. I'm a trauma, critical care, and general surgeon at San Joaquin General Hospital in French Camp, California, just south of Stockton, east of the Bay Area. I served in the Gaza Strip with the World Health Organization and the Palestinian American Medical Association from March 25th to April 8th of 2024 in my capacity as a trauma and general surgeon. Uh, we entered, as I said, on March 25th and stayed until April 8th, just 2 weeks. But in that time, what we saw was pretty remarkable. I was at European Hospital, which was certainly the best resourced city block in all of the Gaza Strip at the time, and it was an absolute disaster. Um, uh, no, it wasn't even recognizable as a hospital. The first thing we noticed was that there were 10 to 15,000 people sheltering on the grounds of the hospital itself, shielding themselves from the attack as much as they could. That extended into the hospital itself. There were actually people lining the corridors of the hospital, staying with their families in improvised tents hung from the false ceiling. They made moving around the hospital obviously extremely difficult, if not impossible. And the the hospital was about a 220 bed facility, but it had 1,000 to 1,500 people admitted to it while we were there, just because of the overwhelming need for trauma care, and because of the destruction of Shifa Hospital, which was completed when I was there on March 29th and 30th. The the hospital itself was really not functional. It wouldn't be accurate to say that it was even partially functional. We were able to do some basic operations, but sterility was just an impossibility. Even basic cleanliness was an impossibility. We had no soap. Betadine was what we washed our hands with, which is known to be ineffective, and it was really quite impossible to talk about surgical success or medical success under such conditions. Everybody we encountered was malnourished. I do mean literally everybody. Even after just a few days, the even the staff that we brought with us, the everybody had pictures of themselves on their phone, saying, don't remember me like I am now. Remember me like this. This is what I used to look like. Everybody's belt was tight. I don't. It's a conservative Arab and Muslim society, so men don't touch women. But the even when I would give a man a pat on the back, my hand would just fall between two shoulder blades and onto their spine. Um, the hospital staff actually lived at the hospital because it was just too dangerous. The Battle of Khan Yunis was still going on. The destruction of Khan Yunis was still happening, and it was just too dangerous to travel back and forth. And often it was just impossible to do so. So the healthcare workers lived at the hospital, sometimes with their families, next door to the room that I stayed in with six other men. There was an anesthesiologist named Dr. Amen, and I noticed one day there were three young women in the room, and so I asked him, and he told me just casually that his house had been destroyed, his wife and his son had been killed, and that he had to continue working to show his three daughters that there was some hope in the world, some life beyond the murder of their mother and their brother. But you could see that he didn't actually believe this himself, but he was doing it for the sake of his daughters. This was common. This was not. He was hardly an isolated exception or isolated case. His English was quite good, so I could speak to him easily. Um, while I was there, I was able to perform operate on several patients who thankfully did as well as they could. Um, but their stories are interesting. The first one actually, the first person I took to the operating room in Gaza was a 26-year-old woman named Isra. She had been, I don't know if it was her home or someone else's that they were staying at, but she had been in a home watching her four children play when some sort of munition came through the roof, exploded, dropped the ceiling onto her children, and she watched all of them die. She was thrown backwards into the kitchen. She came in with a huge chunk missing out of her left thigh, um, four fractures or several fractures in her limbs. She had, I believe, three fractures in her legs. Um, stippling and burning of her face, burning of her hands. Really quite a bad injury, but survivable. For several days, she wouldn't even speak in the hospital, and finally, her family found her. When they explained why she wouldn't speak, I certainly could understand it. And as we left, we operated on her probably every third or fourth day that we were there for almost the entire time. She came in on the first or second day that we were there. Um, when we left, she really begged us not to go, um, and it was hard to. And there was no reasoning with her, of course. She was just frightened um, and feeling lost. But it was almost uh, you can't explain to somebody why they have to stay in this Hobbesian death camp uh, that is the Gaza Strip. Why they have to stay and you get to leave? It just doesn't make any sense. Not even to yourself. Everyone on the trip felt the same way when we left. There was a deep sense, not of regret or of failure, but just a deep sense of shame. Just you don't doesn't seem like you should walk out of this place. Um, you know. Another patient that I took care of was a young girl, 9-year-old girl named Juri. Her story is also interesting. Her family had been forced to evacuate from Khan Yunis to Rafah in the south of Gaza. So they did. They went to their to Juri's grandparents' house. Their mother and father left her and her siblings there, and then mother and father went out to look for food, water, everything their children needed to survive. They came back to the home destroyed. Uh, Neighbors told them their children were all at the hospital, and so Juri ended up at European Hospital. Her three siblings, I believe, ended up at another hospital on the western side of Khan Yunis. And when we found Juri, she actually was just wheeled into the preoperative area. Still, we don't know why. Just kind of randomly, she just showed up. She was altered mentally. She was clearly in septic shock. Her heart rate was elevated, blood pressure was low, and we could see that she was injured, but she was impossible to talk to. She would just scream and cry anytime anybody got near her, and all she wanted was her dad. Um, and so we anesthetized her, figuring we need to figure out what's wrong with this girl. When we turned her onto her side to examine the wounds that she had, both of her buttocks were flayed open so deeply on the left side that the lowest bones in her pelvis posteriorly were exposed. Um, Her left leg was missing about 2 inches of the femur, several inches of the sciatic nerve. A lot of the quadriceps and hamstring muscles were gone. I don't really understand how her legs stayed attached to her, to be honest. Um, and so we debrided away several pounds of dead tissue from this child, who was not a large person to begin with. And over the course of the next several days, I think about 10 days, me, Mark Perlmutter, Victoria Rose, who's a British plastic surgeon, um, and several other surgeons. Omar Afana, he's from Ohio. He came on our trip with us. And then there was a British or two British orthopedic surgeons whose names I can't remember now. We all worked on her for probably about 30 hours total over the course of 10 days. And that was we were able to stabilize her. We couldn't actually reconstruct the massive damage that had been done to her body, but we were able to stop her from dying of sepsis like she was when we met her. And that was a success, and she's actually been medically evacuated to Egypt. I received a video message from her mother through an NGO, and it was very satisfying to see her alive. I didn't recognize her at all. She's gained weight. She has hair again. She looks like a normal child. She smiles. She blew me a kiss at the end of the video. It was very sweet. But she's back to acting like a 9-year-old kid and looking like a 9-year-old kid. I actually thought she was 5 years old when I met her. She was just so small. She'd been malnourished her entire life, acutely malnourished since October 7th. Um, and it's good that we were able to take care of this one child and to keep her alive, keep her as healthy as she can be. Of course, with such a severe maiming, she'll never be normal. Her leg will almost certainly have to be amputated. Her left leg will almost certainly have to be amputated at some point. But that was very. I was very glad for that, obviously. But there are thousands, literally tens of thousands. Actually, I don't think I'm exaggerating by saying tens of thousands of children like her. Now, most of them have died of sepsis because there was nobody around to help them, or they were in their family's tent, or they were, it was just. We only see the parts of Gaza that are accessible to the world, to electricity, to it's what's happening in the and then what's happening in those parts of Gaza is horrifying enough. What's happening where nobody can see anything, I really shudder to think of what's happening there. But in that article, we basically explained the same thing. The large majority of physicians who've been there, physicians and nurses, healthcare workers in general, who've been to Gaza said that they saw children shot in the head or chest on a regular basis, and we're talking about young children, not teenagers. That they saw children die of easily treated diseases. They saw women and babies starved, that they saw infants die of malnutrition related to the fact that their mothers couldn't breastfeed and there was no potable water anywhere in Gaza. Leaving aside that formula was also quite difficult to find. And we also the healthcare workers reported almost universally seeing universal psychiatric distress amongst children in Gaza, up to and including the point of young children, again, not teenagers, young children being suicidal. I've personally worked in Ukraine, in Haiti, in Zimbabwe, in the West Bank. I have never in my life seen a child suicidal, driven to suicidality by trauma. That is a unique phenomenon in the Gaza Strip. Certainly, young children can be driven to suicidality by psychiatric disease, schizophrenia, and other such things. That's quite rare as well, obviously. I'm sure, and whoever is listening to this in their personal experience, they probably don't know any such children. But in Gaza, it was a common feature. Children regularly asked their parents why they couldn't have died with their siblings. They regularly asked why they couldn't have died with the rest of their family. They regularly asked why they had to endure more pain. They would rather just die and see their siblings again, see their friends again, see their cousins again. This was a common daily occurrence, and it's just it is. I struggle as a physician to emphasize adequately how unusual that is. That is not something that I or anyone else has ever seen anywhere else that I'm aware of. If somebody has another example, I'd like to know about it actually. But that as far as I'm aware is unique. I've never seen a suicidal toddler before, and neither has anyone else.